For the last 10 years, I have been treating people of all ages with medical cannabis. I've decided to put together this series, Medical Cannabis 101, to help dispel some of the myths and misunderstandings about this herbal medicine, as well as talk about all of the ways that it can be helpful. So let's talk about it. Hey everybody, it's Dr. David. I'm a board certified pediatrician in Tampa, Florida. I've been a pediatrician for 25 years now. I've also been certifying patients for medical cannabis for 10 years. I own Holistic Pediatrics and Family Care, which is the name of my main medical practice. And I also own Holistic Relief, which is our medical cannabis division. Now, in this video, we're going to be talking about why I am doing this in the first place and who this is for, because there's lots of different populations who may benefit from this. And I'll also talk about the different topics that I'll be doing in this ongoing series. And of course, if you like what you are hearing, if you would like to share this information with others, please do so. But please do subscribe. Please share. It's really helpful to get this information out there to people, especially if you like it. Okay, so why am I doing this in the first place? There is so much misinformation when it comes to medical cannabis. Many people don't know anything about it, or the information that they have is wrong. So as somebody who has in-depth knowledge about this, I figured I need to share this information. And that's the way I've always been, why I've started this channel in the first place, why I give lectures, why I teach about these things, because I feel the more information that's out there, that's accurate, the better. Okay. I also realize that no matter who people are, and that can be even true of very experienced users, people in the recreational realm, they often don't know a lot about this stuff, especially when it comes to purity, accuracy, safety, those types of things. All right, so now in more detail, who is this for? Well, first and foremost, this is for medical cannabis patients, as well as prospective medical cannabis patients. Certainly, a lot of people have heard of it by now. They may be scared by it. They may not realize that you don't have to smoke it in order to get benefit, that there's lots of ways that people can do it. Caregivers, family members, you may know of somebody who may need help such as this, and maybe they're not aware of it. They're not aware of the truth of it. Maybe you're yourself not sure, hey, should I recommend this to a family member, to a loved one, to a friend? But I'm also making this because lots of other people need this information. And who probably more than anybody? Legislators who are writing these laws, but also physicians and other healthcare providers who don't necessarily know that there's a science to this, that there's proper ways of treating, of documenting, of increasing doses, changing doses. And it's not rocket science, but if you don't know about it, it can definitely be overwhelming. Okay. So now, in terms of the topics that I will be covering in this series, I will be spending some time going over some basic medical terminology when it comes to cannabis. There's so many things to talk about, from strains and cannabinoids and terpenes, ways of taking it, onsets of action, microdosing, overdoing it. So I really want to get all of that out there to know that there's a safe way to do this. There's a regimented way that this can be done. But of course, how you take it can make a difference as well. Now, in terms of different conditions, we're going to talk a lot about that, because there may be certain types of products taken certain ways, certain sub-ingredients like certain types of terpenes or cannabinoids that can help specific populations. For instance, we do find that a lot of people with anxiety may do better with forms such as CBG. We find people who may be having panic attacks may do better with an inhaled version because it works onset after. People with seizure disorders, they may only need CBD versions and by mouth and none of the other. So it's really quite able for them to be learning about a lot more if we can explore those different things. We're going to be talking about different types of conditions in particular. So, how does it help people with autism, with seizure disorders, with anxiety disorders, pain disorders, insomnia, PTSD? All of these things may be different routes of work, or dosing may be needed. Some people may need a lot larger doses. Some people may need smaller doses. So how do you figure that out? How do you work your doses up in a routine way that you can document what's going on? How do you figure out if it's working? How do you figure out if you could do better? All of those things are certainly open for discussion. Now, in addition, how do I approach different subpopulations, such as in the pediatric realm, such as they're not smoking it, although they're allowed to inhale it different ways. There's even asthma puffer types of meter dose inhalers that are available. Elderly people, which I find often end up getting treated in both similar routes of administration, but even in terms of the smaller dosing that I do in children, can be really, really appropriate when it comes to treating senior citizens as well. Now, granted, there could be senior citizens who have a lot of experience with it, but there could be elderly people who have never, ever tried it before. Possibly because they had learned about the killer weed, the dangerous weed, reefer madness, all of those types of things that may actually not have truth. But also, let's face it, if you haven't inhaled and you're 80 or 90 years old, you may not want to do that. You may want to know about other ways of doing it. So again, we'll talk about that. But another thing, a lot of my patients, they're on many different medications. And cannabis is broken down in the liver by certain enzymes, as are so many medications. Do they interact? I've put together a tremendous database that allows me to look up all the medications relative to cannabis. You can do medication to medication for other things. I felt it would be malpractice if I wasn't able to provide that information to my patients as well as others, and other physicians. Obviously, if they're referring patients to me, they're very appreciative to know that we've already done drug interaction checkers for them as well. So I'm excited to make this series for you. It's exciting to learn more, kind of think of things in a different way. Lots of things you may know, a lot of things you may not know, but more importantly, this is about education, health, education, and choices. That's what we're all about in our Your Health, Your Choice YouTube series overall. And now we'll be able to focus specifically on medical cannabis. Have a great day.